How's everybody? It's Dr. Jefferson here, DC Foot Doctor. Got a new patient here with us today with a number of issues. Why don't you tell everybody how you found out about us?
From his YouTube channel.
All right. How long ago? How long have you been following us?
About 6 months.
About 6 months. All right. Very good. So you're a fan.
Yes.
All right. Well, we got a number of foot care issues we have for her. We want to take care of her and get on the right road to get everything all nice and healed up. And here we go. So again, it's this young lady's first time here. She's having issues with ingrown toenail here in the big toe. Both of them here as well. The calluses we're going to deal with. And possible fungal infection. So we're going to first take a toenail polish off so I can get a better look at what's going on underneath. They want to trim the nails, and what we trim is going to go to the lab.
Okay.
All right?
Yep.
And we'll go from there. So again, thank you for checking us out, and thank you for agreeing to be part of our channel. We're going to go ahead and get going here. Okay, so the first thing we're going to do, now that we've removed the nail polish and we can really see what's going on, I can see where the nail is ingrown. So you tried to get this out?
Yes.
Yeah, you really kind of broke it off in the corner here. So I can see how it's still...
I messed it up.
Yeah, well, it's not terrible. But I can see why it's uncomfortable. And they're pretty thick here, particularly these. And then, have you been to any of the doctor for the issue before? No?
Never.
Have you tried anything over the counter?
I use fungal stuff.
Fungal stuff? Okay.
Yeah, that you put on your feet. That was about all. There was this one cream that I was using that someone gave me, and I haven't been able to find it ever since. I don't even remember the name of it.
Okay. Well, the nails we trimmed today, we're going to put in this little bag.
Okay.
And it's going to go to the lab. The lab's going to do two things. They're going to use special stains and look at everything under the microscope.
Okay.
And then after that, what they see under the microscope, they're going to run DNA tests to determine what organism is causing the problem.
Okay.
That way we know the best way to go about treating it.
Okay.
All right?
All right.
Otherwise, we're just kind of guessing.
Okay.
All right, here we go now. Since this one's really ingrown, we'll start in the middle instead of on the end. What I like to do is make sure that we cut across.
Okay.
All right, so.
It's hard too.
Yeah, you look under here, you can see the buildup.
Okay,
underneath the bottom of the nail.
So that's fungus,
yeah,
right?
that's typical, yeah.
And that's not supposed to be there.
Exactly. You can see how it's all built up under here. Now this, since most of it you've already taken out, I don't have to do too much. But if this is too uncomfortable, you let me know.
Okay.
Yeah. Was it still hurting?
Nope.
Okay, so you've already gotten the ingrown out, for the most part. Yeah. I'll just be able to file that down for you.
So I got that one out.
Yeah. Now, how long has these nails been a problem for you like this?
For a long time. But you know what? My grandma and my mom's toes was like this. I was wondering if it was hereditary.
Well, got it. Not hereditary as far as like genealogy, but there may be some things they've passed on as far as your foot type, how thick your nails grow, and things like that. But fungal infections, whether they be skin, hair, or nails, are typically a result of an issue with moisture. See, fungus likes dark, moist, warm areas.
Okay.
So if you have a moisture issue and, you know, like the rest of us, you're wearing shoes every day, then you have things that have predisposed you to having thicker nails, whether it be circulatory issues or just genetically thicker nails in most folks, then that will happen that way. So with everything that you've had, all the surgery you've had on your shoulders, your knee, your hip.
Both hips. Only thing I haven't had done was the left knee.
Now, what is the cause of you need to know that surgery to begin with?
My bones were deteriorating.
Okay. Did they know what that was from?
No. No oxygen was getting through to them. It was like really bad.
So there was nothing traumatic that happened that you needed all that work done?
Mm-mm.
And how long ago was your last surgery?
2016 on my shoulders.
Gotcha. Did you have them both done at the same time?
No.
Okay. This was hurting more on this side?
Yes, both.
Okay.
You know, I don't have as much dead skin under that toe as I had the other bit.
Right. And it's not as ingrown like the other one. Like this one is basically just right here. I don't have to fish for it at all.
So that was it?
That's it for this side. Then I'm going to use the burr to get the rest of it.
Okay. Hey, I'm here right now. Yes, I am. I told you, call me on FaceTime so you can see.
Mm-hmm.
Hurry up, call me right back. Call me right back on FaceTime so you can see. This is the one that's in love with you.
Oh, okay.
Yeah. She just texted me, did you go see DC Foot Guy?
She's my neighbor in Norfolk. Oh my God. Oh my God.
You're driving, don't you? You better pull over, don't you do that.
Oh, is she driving?
Yeah. Oh, okay.
So she's not driving?
No, she's not driving.
Oh my God, I watch you every day.
Oh, turn around, sir. So you watch us every night?
Yes, sir.
And you introduced her to us today.
Yes, I did.
Well, I appreciate that. Thank you very much.
No problem. I just want to, be praying for you and your patients all the time. I was like, he's so nice. He's so good.
All right. Thank you very much.
No problem.
We're helping your friend out here. She's coming along very well.
That's wonderful. I love her. Take good care of her.
Yes, ma'am.
I'm happy to good work.
All right. Thank you. Stay tuned. All right.
All right.
All right. Now, does this one ever hurt you much?
Yes.
Okay.
It's like it's a root or something, like, cause they could, sometimes if I could like really soak it before, when I could bend my legs and get down on it and really get in there, cause I've had this on the bottom of my foot for maybe 20 years.
Okay.
And I mean, I used to really take it out, it'd be like a root or something.
Now, is there one foot that bothers you more than the other? Because we see that often after somebody's had knee and hip surgery.
They both do. I can't really say. It
Not one more than the other?
Sometimes, yeah. Well, the right, my whole right side is worse than the left side.
Now, have you tried putting any padding on these calluses or anything like that?
No, should I get those? You talk about like those things for callus removers?
Not removers, just pads.
Pads, no.
The reason why I recommend the pads over the removers
Okay.
is that the removers have a mild acid up. That's how they work.
Okay.
And so, if they're used incorrectly, but even at times when they're used correctly, they can cause a burn.
No, you can't have no burns on the feet.
You know, so you don't have diabetes, but we typically,
Yeah.
we always tell our diabetic patients to never use those.
So what am I getting?
A callus pad. I'll show you what it looks like
Okay.
when we're done. What I like for this instance is a sleeve type.
I've seen those too. With United Healthcare, they have a book where we can order.
Yeah.
Okay, and I've seen those in there, so that's what I'm gonna get.
You slide it right over the toe,
Yep.
just like a sleeve. It helps cut down the pressure and the friction.
Yep, I most certainly am. I didn't know. Wow.
It's looking much better. How we doing now?
Doing great.
Excellent. How the feet feeling?
Yes, they feel good.
Nice. So, we got the nails trimmed. We have the samples we need to send to the lab.
Mm-hmm.
We got the calluses taken care of.
Yep.
And what we talked about, you're going to have to do a little bit every day
Okay.
for a while
Okay.
to keep these from coming back.
Okay.
Eventually, what you're going to need, because your right leg is shorter than your left leg, it's actually pretty noticeable.
Yes.
All right, and that's because of all the surgeries you had. Your hip, your knee.
Yes.
It's going to make the right side shorter because of when there's all that type of surgery, bone is removed as they're putting in the hardware.
Right.
All right. So, have you ever had special insole made or shoes or anything like that as a result?
It's been suggested to me. You think I should do it?
Well, it's going to help things to feel better, particularly your larger joints, because what it will do will help balance out the length of the legs and to help you walk more normally.
You know what? I might go ahead and do it now. I was just thinking about them ugly shoes.
Well, they're much better now, and what you probably could benefit from is from the type of insoles inside the shoe.
Okay, so I can just wear my regular shoes.
Yeah, you can wear mostly your regular shoes.
Okay.
Because they have to be able to accommodate the device inside your shoe.
Okay.
You don't have to wear the Frankenstein shoes like they used to. All right.
Oh, so they have some I can just. So would I have to go to?
Yeah, I have to write a prescription for you, which I'll do today.
Great.
Because what you have is a limb length difference because of the previous injuries and the previous surgery. So that has to be dealt with, biomechanically. You have to make devices for that. And now help things out tremendously.
Boy, it looks so much better.
Yeah. How are we feeling?
It feels so much better.
Excellent.